Hi, my name's Adam Sanchez, and my critically appraised topic is Achilles rupture rehabilitation, early weight bearing and mobilization versus delayed weight bearing and immobilization. My clinical scenario is Beckham, a 35-year-old recreational soccer player, ruptured his Achilles tendon during his last match. His doctor's recommendation was after surgery to immobilize his ankle and to have no weight bearing for up to 3 months. However, new evidence suggests that there are benefits to early weight bearing and early ankle mobilization. The goal is for Beckham to be able to return to play and minimize risk of re-injury. The challenge is to find evidence to sway the doctor's views. Beckham will now go to his friend Ted Lasso to find a evidence-based practice for Achilles tendon rehabilitation. The clinical question is for a 35-year-old male recreational athlete recovering from Achilles tendon rupture, which rehabilitation approach has the best outcome? Early weight bearing and mobilization or delayed weight bearing and immobilization? The database I used to find evidence was PubMed and CSUN's OneSearch library. Keywords that I used to filter articles were Achilles tendon, rehab, rehabilitation, return to play. This provided me with over 200 articles. I narrowed the search by limiting the years that the articles came out. Another filter I used was randomized control trials and systematic reviews. I made an additional search looking at early weight bearing and immobilization. This provided 11 more articles. Finally, I found 2 systematic reviews, and in those reviews, I looked at references to see if any additional information or articles I could use. In total, 3 studies were chosen due to their relevancy, quality, and direct connection to the rehabilitation and return to play question. The first article examined was a systematic review. They pulled 9 different articles, and 8 of them were from randomized controlled trials. The search strategy they used included databases like PubMed, Web of Science, and others. Some of the key words they used for their search was Achilles tendon, non-surgical treatment, conservative treatment, injuries, recovery of function, and immobilization, early weight bearing. The outcomes they measured were re-rupture rates and Achilles tendon rupture scores, return to sport, and return to time to work, as well as adverse events. The results showed that both early and late weight bearing had similar results. An appraisal of that systematic review showed that the applicability lacked detail of the population. There also was no long-term follow-up, and the authors made note that there was influence of the type of cast and specific rehabilitation protocols in the systematic review. Some internal validity strengths was they used a grade criteria and they had 2 independent reviewers go through their search selection. However, there were some key threats. There were no blind studies included in this systematic review. There was also inconsistency on definitions of early weight bearing and rehabilitation protocols. So what that means is some articles said early weight bearing was at 3 months, others said at 3 weeks. So there was inconsistency there. Also, there was missing protocol details throughout the reviews they have examined. The next article examined was a randomized controlled trial. It included 97 patients with acute Achilles tendon rupture. 49 of them were treated surgically and 48 were treated non-surgically. They all received a cast and a standardized rehabilitation protocol with 2 physical therapists. The outcomes they measured were Achilles tendon total rupture scores, a physical activity scale, a re-rupture rate, and they also examined a heel rise work, heel rise height, hopping, drop jump, counter movement jump, concentric power, and eccentric power. The results showed that 12% re-rupture rate in the non-surgical group and 4% in the surgical group. The results showed that as time passed, there was no significant difference between the two groups. This study was applicable to the CAT scenario because it included functional tests like the counter movement jump, which is sports relevant. However, the desired age was slightly higher than the CAT scenario. There also was no detail on the athletic background of the participants. It did, however, focus on re-injury rates and performance-based outcomes. There was internal validity with randomization and a power analysis conducted. However, there were some key threats, like the authors did not include a limitations section or acknowledge any limitations in their study. They did point out that there were complications in 3 of their patients. And finally, although their power analysis showed they needed 100 patients, only 97 were final because 3 dropped out. The final study examined was a systematic review. The authors pulled 6 meta-analyses. Their search selection included PubMed, M-based databases, and the Cochrane Library. The keywords they used were Achilles tendon rupture, injury, tear. Some of the outcome measures that were taken were ankle function, patient satisfaction, and any adverse events. The results showed that early functional rehabilitation was better, unlike the other articles that didn't really show a difference. This systematic review was applicable to the CAT scenario because the authors provided strong evidence comparing early rehabilitation versus traditional immobilization. The authors also provided practical guidance like patient satisfaction and time to return to play. Some of the internal validity was it's the first review to analyze overlapping meta-analysis. They also had 3 independent reviewers. However, there was still limitation. Like the participants' demographic, they didn't specify ages or athletic background, once again. The exclusion of non-English studies, the exclusion of no blind trials were included, and there was also missing data and intervention details that were not reported in the systematic reviews that these authors were also reviewing. In summary, one of the 3 articles did show a slight benefit to early mobilization. However, most of the articles showed that there was no difference as time went on. This gives clinicians flexibility depending on context, like age and athletic background. Future research needs to be conducted, having a long-term follow-up, sport-specific research, and a standardized definition of early mobilization and early weight bearing. So is it going to be 4 weeks, 6 weeks? Clarify what is early. Finally, there needs to be a performance metric that will give clinicians guidance on return to play. Finally, these are the references. Thank you for watching.